Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the beautiful Dolph Simons Family Studio. We are delighted to be back with you on this gorgeous Wednesday morning when the sun is out. There's just a little bit of warmth in the air, and I'm still wearing a mask, and I'm walking in this morning, and it fogged up completely because the humidity was out there, so I couldn't see anything out of my glasses, which means it's a great morning to be here in Kansas City. We have a big welcome to KCK Mayor and Chief Executive Officer of the Unified Government, David Alvey. David, it is such a delight to have you back. I said your first name. That feels so funny. Mayor, it is such a delight to have you back on our program. You have just done the best job, I think, as leading our community, leading Wyandotte County, and really our whole community at large. I think you've been one of the most important political leaders to us. We can't tell you how much we appreciate your leadership and how you believed in both the science and the economy of trying to make sure we've got through this pandemic. Thank you for that great leadership, and we're going to talk to you a lot about that in just a moment.
Thank you.
And I also want to say good morning to my good friend and colleague, Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, also known as Doc Hawk. So we're doing pretty good.
Yeah, we are doing pretty good. We continue to have really low active infections, 5 active infections with 1 in the ICU, but none on the ventilator. Still 7 additional in that recovery period, so 12 total. Just to note, too, we haven't had an inpatient death since May 23rd.
So that's good news.
From COVID-19.
Yeah.
So that's really good news. Hays
and we
has
don't even have
2
that many
active.
recovering right now. I mean, our total is 12. Holy cow. That's great.
Yeah, so, you know, I think, again, vaccinations are working.
Vaccines
I
work.
have to believe that is the biggest part of that, because we know that people are getting together more without masks, and we see it every day, so.
And you got to be feeling safer because we're not seeing the beginning of the ripple yet. It's just hanging pretty well.
Yeah.
So, you know, V for vaccine, live long and prosper.
Yep. And then again, Hays has 2, but I think as we move forward, I think what you said a week or 2 ago is absolutely right. I think the way that we are going to be able to tell how the infection is going in our community is by hospitalizations.
Yes. So. It is the bellwether because people aren't getting tested as much. In fact, here's my story. I had 2 patients call yesterday, and one of them said, hey, I got a little bit of sore throat. They've been vaccinated. Okay, so am I going to have them run and get a COVID test, or I'm just going to say, stay home, get better, wait till your throat feels better, give yourself 24 hours, and then let's see where you go.
Yeah.
Because they're vaccinated. How many times do I have to keep checking people who are vaccinated? I think that is a question. So where we landed on it, just so you know, where we landed was, okay, if you don't sound sick, we're not going to check right now. And I think there's a lot of we're not going to check because what we're seeing in the hospital is the people who are coming in that are positive are patients who are coming in for another reason, have been vaccinated, and are asymptomatic for COVID. They have a positive test.
Yeah, absolutely. Non-COVID reasons, you know, there are still a lot of medical conditions that are going on. There have been through this whole pandemic, but they are coming in for, you know, other typical or routine medical needs. And as our admission screening with a PCR, we're doing that and finding a lot of these patients.
And, you know, we've stressed all along the importance of vaccination, in part because we don't know how well host immunity lasts or works against some of the variants. And we see that internationally as well, because there are a number of countries where things aren't going as well. And there are countries that are in significant outbreaks, Uruguay, Paraguay, Brazil, Argentina, as well as European nations, African nations. And what we know is areas where there's not the right kind of host immunity, meaning that some of these variants are going into a population where there may have been 20 or 30% of people who have already had COVID, but they can get a second version of this because the host immunity doesn't protect you against some of the variants.
Yeah, and we're actually seeing better data now on the vaccination immunity towards the variants, and that does look better. Although the main standard or proxy that we use to look at immunity is the antibody levels. There does seem to be some decreased antibody levels against those variants. There is still what we consider good immunity from the vaccination itself to those variants. And
so vaccination is the way to really get us out of this pandemic. It's great that over 50% of Americans have had 1 shot. We need to get more than that. We need to get to that 70 or 80% of Americans having had vaccination. That's when we know we're really going to be safe. And will it even be safe then when we go back into Allen Fieldhouse to do a little rock chalk dance this fall?
Yeah.
So the other question then is, how long and how well does vaccination work? It looks, Hawk, it looks like it's good for probably a year, and it's probably going to work against all the variants we've seen so far.
Yeah, I mean, I think that, you know, they're looking at, again, antibody levels. I don't know that they're really testing T-cell response for that duration, but the antibodies look like they're have very good levels for quite some time, probably 8 months or a year or more. But again, we know that's not the whole story. But even when those antibody levels do wane, we do understand that you still have those cells that are in your body to ramp up production of those antibodies pretty quickly.
And I think it's also important to point out that those countries where there had been widespread disease, like England and the United States, are now doing so much better because so many people have been vaccinated, and the same thing is true in Israel. So if you look at the countries that are leading the world for vaccination, they're also leading the world with much less infection rate, and they don't have to be worried about the variants. So
yeah, and I think I saw something today. Maybe England didn't have a death yesterday from COVID-19,
that's crazy,
which is amazing.
Good. So. Crazy good. So there's a way out of this pandemic, and the way is because we've waited with faith and hope to rely on the science and to trust that science. So let's see if there are any reporter questions out there this morning. I'm not here.
I do have one from CNN.
Go for it.
They want to know, what do you mean by we don't have any true COVID patients? What does that mean?
You bet. So are you being admitted into the hospital because you have COVID as your primary symptom? That you have fevers, chills, shortness of breath, all the things we know can be caused by COVID, and that's why you're here? Or are you coming into the hospital because you're having a hip replacement? Or you're having some other type, you fractured your leg, or you've been in a motor vehicle accident, and we check you and you turn out to be COVID positive, but that's not why you're here at all, right? You're asymptomatic from COVID. So if you came in and you had shortness of breath and an infiltrate, okay, that's COVID. But if you're coming in and you broke your arm and you're in the hospital and we're in the emergency room and we check your COVID screen and it's positive, well, you're not really here. Or let's say you're delivering your baby. We've had a number of patients on the labor deck that are COVID positive, but they're here to deliver a baby. And so when you look at like that, then those patients really would not be admitted with COVID because they don't have COVID symptoms. What they really have is some other thing that's brought them into the emergency room. So that's not someone who is truly symptomatic with COVID. And most of those people like that we've just described have been vaccinated, which we know that's really how the vaccination works, right? It helps you from not getting COVID, but what it really does is it prevents you from getting sick and dying with COVID, Hawk.
Yeah, or like you said, just something else, diabetic foot ulcer that's worse, and that you need care for your foot. But yeah, the vaccination protects you against that whole spectrum of disease of COVID-19, and especially that severe disease and death. So, and I think that's what we've seen, and our numbers are very indicative of that. And I think talking with other CMOs, we do understand that it's similar around the city as well.
Any other questions out there today? Because then I get to speak with our good friend and the Honorable Mayor David Alvey. Again, Mayor, welcome back to our program.
Thank you.
Wyandotte County let its mask mandate expire on Friday night before Memorial Weekend. What factors kind of led to that decision?
So we had, it expired. There was a date set, and we actually, once the CDC released its new guidelines, there we are.
Just look over here so the folks can
My bad. You should think I know better by now.
Just ignore Dr. Stein.
Yeah.
Is that
Everyone
how
else
this
does.
works?
All right.
Is that how this
That's what
works?
Jill says every day. Ignore it. Or as they
And
like to
crowd,
call
don't
me,
get mad at me for saying that.
or like they call me now, I just learned what they like, Yosemite Stites, because I shoot from the hip sometimes. Thank you, Logan.
But I think really what happened is we began to, again, continue to monitor the data. When the CDC released its new guidelines, there was some question. Frankly, I think it signaled some wrong messages, and that was my concern. That when people, I think, hear, let's say, from the CDC or even from Wyandotte County, it sends a signal, and really that's the most important thing we do with any of the mandates, any of the restrictions we put. It was a signal that this is getting serious. We need to take some action to reduce the spread if we do these things, and really it helps us to guide our behavior. When the CDC came out with that, frankly, I think it undermined a lot of local efforts to try and keep doing what we needed to do locally. Our experience in Wyandotte County is not the experience of other places. I get that, but and we're part of a larger metro area. So when the CDC did that, I think it undermined some of our messaging, and some of our concerns were kind of set aside, I think, generally by our people. And so it was very hard to continue to sustain that because CDC kind of overrode, I think, what we might even do locally, which is unfortunate. That's been one of the dynamics politically throughout the whole pandemic is the lack of consistency from the federal level all the way down to the local level in what is the nature of this virus, what is it doing, what do we need to do to response to it, and let's all come together to craft a common response that I think would have been much better and much more effective. I look back, so I think what happened with us is it was relatively undermined. The data was much better. I mean, that's what I'll say. The data from Wyandotte County was much better in terms of infection rate, positivity rate, and so it seemed as if that it was time to go ahead and let that mandate expire.
Yeah, well, and I think I can understand that. And how do you think that the county's response has been? And you've been said you felt it was exceptional, by the way. I think it was exceptional as well. But tell us why you think so.
Well, I think one of the factors that play in Wyandotte County is we're very aware of our health rankings in the state of Kansas. We're still like 103rd out of the 104 counties of the 105 counties that actually report the health data. We're still almost at the bottom. And so we had a large population of people who are vulnerable. You know, we talk about those comorbidities, and we were very aware of that and said, all right, well, if this is going to come into play, if we don't stop this, it's going to we're going to have far more death and serious illness, and we did not want to overwhelm the healthcare system. We were very aware of HaysMed that brings in patients from all over the place, Providence Medical Center, and so we felt that we needed to jump out in front of it. And so I think throughout we've always tried to say, well, let's look at what's happening elsewhere. What's happening in New York City very early, Italy very early. What is happening there? We felt like we had a 2-week window into what might happen in Wyandotte County. And so we took that data and really crafted our responses to say, well, that's where they are this week. In 2 weeks, we could be there. Let's make sure we don't get there. And we empowered our public health department to do what it needed to do, frankly, to protect our citizens. And I will say, from the very beginning, I have to get out there and say to people, look, if we don't take these actions, if we don't, if we don't do the emergency order, if we don't have a stay-at-home, if we don't do the mask mandate, you're asking me to explain to our people that it's okay for a certain number of people in Wyandotte County to become seriously ill and die. And so tell me what that number is and then point out those individuals to me. Because as the chief elected official of the county, I can't get up to say in front of people and say, I'm okay if a certain percentage of you die from this. I just can't do that. So I really feel as if with that in mind, this is what the virus is. Let's not politicize it. Let's just get this and kill it. I always tell people we need to stomp it down before it stomps us. And every time we gave the virus oxygen, it would flame up. When we took the oxygen away, it died down. That's been the fundamental dynamics throughout it's how a pandemic works.
Yeah. It is how the pandemic works. Exactly right.
Yeah.
And give us a sense, where do you think the Wyandotte economy is throughout all this? Because I know that's the other side of the equation. You've had to balance the entire time.
Yeah, interestingly enough, most recent numbers we've had from, let's say, the Legends area is we are 6% beyond where we were last year.
That's amazing.
No, much more. 6% where we were in 2019.
Wow.
And so that tells me that people are getting out and wanting to get engaged again. That's all great news. I still would say to people that their businesses are going to want to continue to require you to wear a mask. Some of them will. Unified Government will, because we do have people who are not able to get vaccinated because they have immunocompromised systems. And so to protect them, let's continue to mask up. And if a business decides not to require even unvaccinated people, that's their business. But throughout the thing, it's interesting, if you look at some of the data I've seen, those counties or jurisdictions that had mask mandates, adjacent to counties that did not have a mask mandate, a government mandate, there was only about a 10% difference in business activity between the two, which says to me that individuals were, in fact, taking responsibility and saying, I'm going to restrict my behavior because I really want to protect myself and my loved ones and others I meet from the virus. And so they're making those decisions, and they restricted their own business activity and personal activities. So whether the mandate, I mean, it does signal that there's something serious going on, but what really happens is people are taking stock and saying, I don't want to get the virus. I don't want to give it to my loved ones, my customers, my workers. So we're going to do these things. We have to respect people who want to make those decisions. If part of the pushback is it's personal responsibility, well, then let these businesses take personal responsibility and respect them. Because I'm getting reports, for instance, of people going into businesses and complaining because they're asked to mask up still. And frankly, if it's about personal responsibility, respect their personal responsibility for their own business and activities.
No, I think that makes complete sense. So, it's amazing that the county has done as well as it has economically through this. And that doesn't mean that there hasn't been hardship for individual people, but it does mean we had to focus on, the overall global good here. How are we doing on our vaccination rates here in Wyandotte?
And that's problematic because we are at, for those who are all, all residents, we're at 30, last week we were about 33%. We're about 40% of those who are eligible. It's been very hard to make some progress, from some folks who still don't, again, think that this is serious, that they don't know what's in the vaccine. And I will say to them, did you know what was in the polio vaccine? Did you know what was in the measles, mumps, rubella vaccine? And of course, they have no answer for that. And I said, but they want to have enough evidence on this, and I think, frankly, we do have plenty of evidence. This SARS kind of virus has been studied in vaccines practice, and there's a lot of research on this already, 20 years of research easily. So we do have a lot of data, but it's just difficult. So we're doing whatever we can. We're being much more targeted in identifying institutions, churches, others who might want to come in and get vaccinated. We'll send the team out there and vaccinate. But I hope people will see that that the vaccine does help. They start paying attention. That they're going to still see people who are not vaccinated getting sick, and that might indicate to them, okay, this is worthwhile for me to go do.
I totally agree. I think that is the key to recovery from this pandemic, and long-term economic sustainable recovery is going to depend on the health of your workforce. Health of the workforce depends upon vaccination around COVID-19. The equation's pretty simple, I think, honestly, if people will just take it seriously.
Yes.
So I understand there is a question from reporter Taylor.
Channel 41.
Hi.
Hey, Taylor.
I have a question for Mayor Alvey and something you were just touching on there. That's why I didn't ask at the beginning, because I wanted to wait and see how you guys brought it up. Mr. Mayor, I want to ask about with those rates being what they are and kind of starting to slow maybe a little bit and not, at least not progress the way you'd like them to. We've seen other federal, or not federal governments, we've seen other state governments and other businesses offer incentives to people to go and get their vaccine. Is there any plan for Wyandotte to do anything like that? Is there anything like that in place? And what do you see as what the government's role is in getting people to go and do that? If you had the ability to do anything to encourage it, what would that look like?
So it's really what we're doing already. The health department is reaching out. They have regular meetings with our business community, and they to encourage them to will come on out. The Speedway is sponsoring a couple of vaccination clinics there. We've had other large businesses in Wyandotte County sponsor those. Churches are doing this. So we're doing what we can. It's perplexing, though, because we do have some businesses that don't seem to want to do this. And again, I hate, it'd be disappointing to say that they would have to experience more spread among their own employees or customers before they might want to do one of these. So it's a little discouraging. I think in terms of the role of government, it's very difficult now because of what's happened to the state legislature in Kansas, really discouraging local governments and continuing to drive away from local governments the authority to do something, and then it kind of devolves to individuals. And so I think in a way we've been hamstrung by what's happened at the state legislature. But I will say that I think one of the factors come into play here, but I don't have any data to demonstrate this, but it would seem to me that among a lot of the folks in Wyandotte County, especially the Hispanic community, they're very social, very family oriented, and it's not just their immediate family, it's the extended families. I think they continue to come together even during the pandemic, and because it's just their culture, and they love one another and want to be around one another. But I think there was probably more spread than was even reported or registered, and I think that they might have concluded that, well, I've already had it, and therefore I've got some immunity to it. But so the data that Doc Hawk, reported today, that that host immunity is not as strong as what the immunity comes from the vaccine. I think that's a nuanced message. That's really hard to disseminate, unfortunately. Some of the intricacies of all this is frankly lost on people. You have to really attend to this to really understand it and be able to make those distinctions. That's a little bit. This is of a different nature than that, and that's hard for a lot of people in general to do.
Ted, a follow-up?
None for me. Thank you very much.
All right. Anyone else out there? Mayor, last question I want to ask you directly. There'll be more from the broadcaster in a moment, but tell me, what are the lessons that the unified government that has learned, that you've learned from this pandemic, and how are we going to implement those lessons?
Well, the simple things, and I remember when this first happened, even KU, the Med Center was talking about how the remote medicine came into play, that it was supposed to be a 2-year rollout, and it happened within a month or two, or
yeah,
month
2
and
weeks.
A half. That's amazing to me. It's amazing. Necessity is the mother of invention, or innovation anyway. And so one of the things I've learned is that when we do remote meetings or commission meetings or special sessions, it actually makes the government more accessible, because if I'm a citizen and I want to attend the meeting, well, I've got to drive downtown, I've got to park, I've got to go through the security, I've got to go sit, and then if the item I'm interested in comes, who knows, maybe an hour into the session, that's a pretty big commitment. And so I think it discourages people from getting engaged. Well, now that we can do Zoom meetings, it means more people can log in. That's a good thing. I think in general we're going to be much more, I think it's spurred greater efforts to really work through those, the health equity that we need to achieve, the disparate health outcomes for different populations. It's really focused us in on that. I think we are also, one of the most important things for me is that when this first happened, there was so much information, so many things we didn't know, and so many things we needed to hear from our community. And so I started a collaborative, and so the major institutions in the county, as many as we could, the school districts, the hospitals, the social service providers, our emergency management, the mayors of Edwardsville and Bonner Springs, city managers, all those people, we had a daily call so that we could, first of all, disseminate information, take questions, solve problems together. That was very effective. And so one of the things I've learned from this is to be able to call those individuals together on a regular basis, to give them right now information and take in questions about governance itself. We also, because the first spread, if you recall, in Wyandotte County, very serious spread through religious congregations. And so I called together the pastors as well with our health director and took their questions and asked them to please take the message out to their congregations. That really solved a lot of communication problems, because we don't have a local newspaper that's fairly, day to day, doing the work. Kansas City Star doesn't report much from Wyandotte County, and so it's very hard to get information in or out. And so we just had to cut through all that, and the communication efforts have been extremely helpful and necessary.
I think they have, and I think, again, you guys have done a great job, and I think Wyandotte County has been the beneficiary of that, because if you look, I mean, certainly Wyandotte County had the battle with COVID-19, but as you look across different communities and counties around the country, given our population demographic and what could have been, I think actually we did all right. That doesn't mean we don't want to do better, but it does mean if you look at where we are relative to some other areas, we've gotten through this.
Yes, we have.
Jill, let's see what questions are out there. I bet
Yeah,
there are a
Isaac
few.
has a couple that are on topic, so I'm going to start
Let's
with
do it.
him. He always has good questions. One of them was, since Friday when that mask, I'm adding this part, but since it expired, have you seen a noticeable change in people masking or unmasking? He just wants to know.
I think so. In fact, I would say that once the CDC guidelines came out, we noticed a significant change. Because, again, people had mixed signals. Whether they follow the CDC, did they follow Wyandotte County? And I think that was, I think since the CDC came out with those guidelines, there's been a significant change.
And then he has a question that's kind of the opposite of Taylor Himna's question from 41. He said, I recently saw or read about a concert in Florida where the price was $18 a ticket if you had the vaccine and $1,000 if you were unvaccinated. And he says, what do you think about disincentives?
Yeah, I mean, that would be up for the business to decide. I wouldn't, I'm not going there.
That's a big differential.
Yeah.
Right, that's a big differential.
And part of me would say, gosh, let's do that. But I don't know that that's the right choice until we have a fully FDA-approved drug, even though I believe that the vaccine's entirely safe. Over 1 billion people have been vaccinated worldwide, and we vaccinated 90,000 people, or 45, 50,000 people, and 90,000 people, or we've given 90,000 different shots here in ourselves, which is really the size of one of the studies by itself, right? And Moderna and Pfizer, there's some of their data they got their EUA on. That was based upon the number of patients we've already given it to. And we've just seen really incredible outcomes and really good safety. And if you had told me that vaccination was going to be as safe as the COVID vaccine, Hawkeye, I think we would have jumped for joy. Not just the point of how effective it is, which is also a way to jump for joy. It's kind of like watching Benintendi hit that grand slam home run last night. I had to jump for joy for that.
Yeah.
But I'm saying that I think the vaccine safety is really remarkable.
I think it's unheralded, really. When you combine the safety and efficacy and the expedited process that it took to make it, obviously we know that platform and that technology has been around, but to actually bring it to bear, and I think that's incredible. And there's just so many components to that. But like you talked about, people worried about, what's in the vaccine. Well, we know that people are taking medical drugs every day, for different conditions, whether it's diabetes or heart disease or cancer, which have significantly worse components in it and higher concentrations. We know that cigarettes and vape have worse components, and people are putting those actively in their body, volunteering to do that, but yet 1 or 2 doses of a shot with very minuscule amounts of any components or drug in there, they're still unwilling to do. But the safety profile is really, I think, unheralded compared to some other things for sure.
Okay, Maggie has a clarifying question for you, Dr. Steit. She said, why not have your patient get tested? I thought testing was important.
Testing is important, I think, and so we end up getting almost everybody tested. But sometimes if somebody calls you with a sniffle, they've been vaccinated, and they say to you, I really don't want to go get tested. Do you force them to get tested? I mean, I can't force anybody to go get tested. So you just have to use the best part of judgment. And I'll be curious to see what you think here, too. And for example, one person says, that sounds more like allergies. Well, let's treat for that and see how you do. And another person had more GI symptoms, and they weren't that sick. Let's see how you do. It's one of those questions of judgment. We still tell them, stay home till you feel better, et cetera. And again, they've been vaccinated. And so I feel differently when people have been vaccinated, when they have been vaccinated. I don't know if that's right or wrong, Hawkeye, but I also think we're trying to manage an entire population, and some people don't want to go get tested. What are your thoughts about that?
To be clear, you did say let's wait 24 hours and see that.
Yeah.
It's not like you said don't go get tested.
No. In fact, if you get worse, you're going to get tested, absolutely.
Yeah. And they were fully vaccinated. And with the population that you deal with, they are probably taking their utmost precautions anyway.
Yeah, that's a good point. Because we have a lung transplant CF population, and most of those guys have been wearing masks forever because they have to wear masks in order to preserve their health on a day-to-day basis. In fact, they've all kind of enjoyed the whole. That's not a fair statement. I don't mean to be that flippant about it, but they have had a different perspective on the pandemic because they're like, look, guys. what's happening is everybody's doing what we have to do every day, which is to wear a mask anytime you go into a crowded public space.
Yeah.
You go indoors, people you don't know, because you don't know what's going on out there, and you're immunosuppressed, and so therefore you're going to want to take special precautions. And so they really do. They act a little differently. On the other hand, again, if any of them start to get sick, boom, we're going to really go ahead.
Yeah, and I
test
think
them.
it depends also what you're doing. You know, front facing, like for me, I've said, since I'm front facing, I'm seeing patients, I'm in with other people every day just in my job duties. If I have the slightest bit of cough or sniffle, I will probably go get tested because I know that impacts myself, my ability to work, but my patients and my coworkers as well. So I think take that into consideration. If you can otherwise stay isolated for an amount of time, I think that's reasonable, but yeah.
Okay, so Mary said, I recently gave blood and my antibody results were returned as reactive. Explanation seems vague to me. What does that mean?
Yeah, it has to be. I'm going to assume that you had a COVID test that came back reactive as the antibody test. We'll make that assumption to start, Hawk. But it means you've been exposed and had COVID at some point, and you may have been asymptomatic from it. If indeed the testing you're referring to is a test to SARS-CoV-2.
Well, she said she gave blood. So what kind of testing do they do when they donate blood?
Yeah, they actually do a wide range of testing.
Yeah.
You may know that.
Yeah,
better
I
than
mean,
do.
so, initial tests that have been around for a long time that they look for is hepatitis A, B, C, HIV, things like that. I think we are assuming right now that test that you're talking about is a SARS-CoV-2 antibody test. The question is that to spike or is that to nucleocapsid? And the nucleocapsid is just another protein. That would signal that you've had exposure to the actual infection and virus. If you had the spike protein, that could mean that's positive because of either vaccination or actual infection. It's reactive because that is a qualitative test, not a quantitative test. It's just telling that you have it or not. It doesn't give you a specific level. Again, I wouldn't take too much from that, whether you've been vaccinated or whether you had natural infection. There's not really much to glean from that. If it were negative, you can just say, well, I know I either haven't had the vaccine or the infection.
But you'd have to also make sure that you know what they were reactive to in that test. Because
Yeah.
you were reactive to something, but because there are multiple different things that they are testing you to, you have to find out what you are reactive to.
She could probably
Yeah, I mean, I
call
think
the
we're
blood
assuming
center,
right now
right?
it's a SARS-CoV-2 test, so it's either nucleocapsid or spike protein.
Yep.
And actually, June 14, I think, is Blood Donor Day, and we're going to have a bunch of people that are
good.
experts in blood donation
Yeah.
on that day. So
Is Chelsea back with us that day?
she's going to be back. We're going to have someone who's been a longtime donor. We're going to try to find a recipient.
Awesome.
So it should be just for people that are interested in that topic. Betsy wants to know any word on a Pfizer COVID pill.
Oh, nothing new that I know of as far as either the treatment or the vaccination. Not anything new. I know
No.
clearly there are ongoing studies regarding different treatments for COVID-19 that may help feel a little bit like Tamiflu, but nothing new that I have to report.
Yeah, I haven't heard anything new either. I suspect a lot of these trials now are going to have more difficult time. That includes for other vaccines, but also for treatment. Just as people are getting weary of this whole thing. People aren't getting tested. Vaccinations have really helped cut down on the amount of cases and hospitalizations as well. But I haven't heard any new updates on any specific pill or oral therapeutics.
Rachel said, do I have antibodies if I've had norovirus?
Norovirus,
N-O-R-O.
yeah. What do you think, Hawk?
Yeah, so kind of a vague question as well. Everybody has antibodies. Your immune system produces antibodies against infection. If you had norovirus, you probably have antibodies to norovirus. Antibodies are just a wonder of human nature. They are very specific for very, very small pieces or very small areas on any given pathogen, like a fungus, a virus, a bacteria. So they are very specific. So if you had norovirus, you probably have norovirus antibodies.
Arietta says, I can tell she's feeling a little bit of shock and awe from people acting like the pandemic is over. And her question is, we're still in a pandemic, right?
Yeah, we're still in a pandemic. We haven't declared it officially over because there's still widespread community transmission of SARS-CoV-2. Fortunately, it is not spread very readily to people who have been vaccinated, though they can get it, as evidenced by our admission numbers. But the reality is that you don't generally get sick or die from it. And I think that as long as SARS-CoV-2 is out there and as long as we're seeing it rise throughout the world, remember a pandemic means it's across the entire world, not localized to one country or two countries, but but throughout the entire world, and there are countries that are still being having significant toll and devastation from it, especially in those regions of the world that haven't been vaccinated at all, or have only like 1 or 2% of the population that have been vaccinated. Then it's still wreaking a havoc. And so I think that when you look at it across the global standpoint, even if here locally we say things are much better, across the globe, it is not. There are still countries that are not doing as well. Now, the overall drop in new cases, I looked at that this morning. Again, it is reported in the New York Times, open access media, part of that newspaper every day. And you can see the drop in the number of cases worldwide. But there's such bad reporting going on in some of the countries that are now being affected, it's really hard to know if there's really a drop or there's just not as much public health infrastructure to report on the information, which I suspect is actually the case.
Yeah, and although we're not really impacted as significantly on a daily basis from friends and family that are getting sick or coming to the hospital, we do see it. Economically, we see it. We see the shortages. We see the supply chain issues of those countries that we rely on a lot for our supplies, our supply chains, things like microchips, wood, all of that. We've heard those stories. We've seen those stories in the media. So it continues to be a large impact. We are very fortunate, I think, here in the United States, but really around the globe, it's still a pandemic.
And what I would also point out is that we still have a lot of new cases in the U.S.
Yeah.
If we were looking at these numbers without respect to where we've been and just look at the raw number and compare that to the flu, you'd say, we still got a lot of cases out there. The reality is it just feels much better than what it was. It feels better. So it feels like the pandemic isn't really there. It's still there. And it wouldn't take much for it to light fire again, especially if we don't reduce the rate of community transmission, because that's how you get rid of the variants and that's how you really get free of the pandemic, which means you have to be vaccinated. I'm sure you knew that's where I was going to go.
Yeah, and Scott I think we need to clarify just a couple of things. He might be like tuning in and hearing part of the conversation, but he says, didn't you count, that's the question, patients that came into the hospital for something else, but screening showed COVID as COVID patients? Seems like you've changed the process.
Yeah, actually, we haven't changed the rules at all. The difference is this. At the height of this, and for most of the last year and a half or whatever, or 15 months, that if you came in and you were positive for COVID, you were also having symptoms of COVID. Today, when you're coming in, you're positive for COVID, you're coming in for other reasons. And that was a minority of patients than before, but it's still a small number. It's just that we're not getting sick people in anymore because of vaccination. And remember that a lot of our sick folks were people who were over the age of 60 or over the age of 70 or 80 or from nursing homes. And the reality is that the uptake of the vaccination in those populations is really high. Yeah. And so they've got a lot more protection than somebody who, say, are in their 20 or 30 something. So actually, we haven't changed the definitions at all. It's the difference between having 125 patients here with COVID-19, of whom 118 of them are really sick with COVID-19. And today, we have 2 patients with COVID-19, but they're not sick. They're really not here for that reason. And the difference is, because we have so much better vaccination rates, over 50% of Americans have had one shot at least, and there is some host immunity that's already occurred probably in 20 or 25% of Americans, then you figure that's the reason the numbers are down. And by the way, don't know what the CMO numbers are across our community right now. Last week we were down and other hospitals were up a little bit. But I think the fact that we're staying down, I suspect everybody's kind of hit a plateau, and this is where we're going to be for a while. Other thoughts you have on that?
No, we have not changed our definition at all. The problem is, we were seeing too many people with symptoms and COVID positive. We saw a very, very small percentage of people that were coming in for another reason that were COVID positive. So now that balloon is squeezed, if you will, and now just the majority of our patients are coming in who are not having any symptoms and are in for other reasons. But we still occasionally continue to get some of those COVID patients that are having COVID symptoms, worsening shortness of breath, just feeling crummy. It's just less.
Time for a couple more.
I've got time. Mayor, do you have time?
I have time.
Let's
All
do
right,
it.
2 more questions. Cindy wants to know, the World Health Organization, she read, was changing the names of the variants and labeling them in the Greek alphabet. She wants to know, are they worried that they're going to have so many variants that they have to do that? Why rename them?
They're trying to get away from attributing it to one country of origin, because even the South African variant turns out to have arisen in different countries at the same time, Hawkeye, and so as a result to call it South African variant feels wrong, and I think that's why they're changing it.
Yeah, I think they are just kind of wanting to go away from stigmatizing a whole country. I think also the letter form or the clades, if you will, the B117, B1351, P1, all that got difficult as well. But now, of course, they're just adding a third wrinkle into this, and that's I'm going to definitely need a chart to remember exactly which ones. But yeah, I think for various reasons, I think mostly really to kind of protect stigmatization of some of the countries.
Yeah, I don't remember my Greek alphabet well enough. I know I can do alpha, beta, and I know gamma and delta are out there, but I forgot what the next one is, or I don't remember. But at any rate, well, I guess we'll learn as we see other variants.
I think B117 UK was alpha. South African might have been beta, and so on down the line. But yeah, you need a chart.
Yep, there you go.
And then to further complicate it, John read, he has our last question. What is the significance of the reported hybrid variant that is combining the UK and South African together? Is that more dangerous? Or?
Yeah, well, first of all, it's not a surprise because we know this happens all the time well, first of all, just because a virus mutates in one part of the world doesn't mean it can't do that exact same mutation in another part of the world. The second thing is, once you've got one mutation, you can get another mutation. So really, these viruses and all these variants, they combine all around the world to have different variants and different presentations.
Yeah, I mean, I think clinically we haven't really seen much change from, say, the original Wuhan strain or one that kind of had developed from that, the D614G. Clinically, we haven't seen with really more severe disease or outcomes. You know, there is that prospect that they are, quote unquote, more transmissible, whether it's because they bind tighter to the receptor on the body, causing easier infection, or for one reason or another. But we haven't really seen a change that if you get this virus, it's more severe, you're probably more likely to go to the hospital. We are still monitoring that. I think the more important part is that immune evasion, and especially with natural immunity with infection, especially if you were infected, say, in 2020 compared to now, with all these circulating variants, you probably don't have as good immunity. But there is good real-world data and benchtop lab data showing that you still have fairly good immunity if you get vaccinated. And so that's why vaccines continue to be so important.
And Mary, I said that's
Mary,
the last question.
wait, what happened to the last question?
I know, but she has a good follow-up. So this is the final, for real. Mary wants to know, are patients who are discovered upon admission that they are COVID positive treated for it? Or are treatments reserved for those patients who are very, very ill?
That's a great question, but we give treatments if you can. If you're admitted to the hospital for COVID-19, you're going to get treatment because you had to be sick to get into the hospital to start with. So you're going to be started on some therapies, at the very least Lovenox and maybe steroids and or Decadron and other things. So no, these are people who are asymptomatic. I'm here to have a baby. And well, maybe not me, but somebody who's here to have a child and they're in labor. We test every admission into the hospital. That person's not here, has nothing to do with COVID-19. We test them. They turn out to have COVID-19. They be COVID positive. But we're not going to treat them because they're not sick at all, Hawk. They're here to have a baby.
Yeah. So, you know, the anticoagulation you mentioned, I think, is a good part because we do understand, and I've seen people who were sick, 2 or 3 weeks ago, but then finally came into the hospital because they're having shortness of breath. They weren't very sick at all, maybe for a couple days, but they ended up having blood clots in their lungs. So, the anticoagulation, barring any other contraindications to getting that blood thinner, you're probably going to get. But as far as remdesivir or steroids, you're really not going to be treated unless you meet that criteria saying you need oxygen, you're having increased shortness of breath. Those are really the signals and the triggers for getting the remdesivir and the steroids for therapy for COVID-19. The blood thinner, most people probably, if they're positive for COVID-19 or SARS-CoV-2, unless they have a contraindication, are probably going to be getting some manner of blood thinner so they don't develop those blood clots.
And also be clear, for example, people come in the hospital all the time with one problem, but they have a whole list of diagnoses. Like I got a whole list of diagnoses, and so if you come in, let's say you have a history of coronary artery disease, but you've been in a motor vehicle accident, well, you're not being admitted because you have coronary artery disease. You're being admitted because you were in a motor vehicle accident. So we note your other history, even though that's not the primary reason that brought you into the hospital. When we say you're acutely ill with COVID-19, it's because you're here and you need to be in the hospital because of COVID-19. That's what we counted as acute infection. That's what we counted at the height of the pandemic. That's what we counted at the very beginning of the pandemic, and that's still how we count it today.
And again, just because if we test you, that you may stay asymptomatic, have no symptoms all throughout that, but at the same time, we know you can be positive on the test 2 to 3 days before even you have symptoms. So you may even develop symptoms while you're in the hospital. And so at that point, we would treat you if you meet criteria.
Hey, tomorrow our Executive Director of Mental and Behavioral Health Addiction, Lauren Luck, joins us. She'll help explain why and how people not prone to anxiety and depression might be feeling both during this pandemic. Everyone is feeling the effects, some more than others. She'll help us break that down. So let me turn to our panel today. I'm going to ask first the Honorable Mayor David Alvey for final thoughts. And again, Mayor, I'm not trying to just be too darn nice to you, but you've just been so darn good for this community. I really want to say thank you for all the great work you've done in helping lead Wyandotte County Unified Government and our Core 4 and our whole metropolitan area. Can't tell you how much we appreciate your leadership.
Thank you very much. Thank you.
Final thoughts for today.
Please get vaccinated.
Live long and prosper.
There you
The
go. All right.
vaccination.
That requires some coordination. I have to think that one through. There we go.
You got to just be a Star Trek geek like myself or nerd on that. That's it. Yeah. Hawk.
No, thank you. Thank you to the government and the Wyandotte County Health Department. We know they have been out front and on the front line since the very beginning. We know, and again, we see, although we are doing very well here and very fortunate here in the United States, we have a supply of vaccination. We know things are different in other countries. So the pandemic still is out there. We can do all that we can do to continue to have those restrictions lifted, have the no mask mandates, being out doing what we want more than we were a year ago. But that is because we have vaccination. So please continue to get vaccinated.
So we're going to turn to our final thing we want to show you about how we flipped the studio last weekend because these guys worked enormously hard. And we want to say a special shout out to our team, a shout out to all our political leaders locally, and to all the folks out there who have helped guide us and keep us all safe during this pandemic. A shout out to all of you who have been watching this program for the last 15 or 16 minutes, however long it's been. We appreciate that you have tuned in and been with us and ridden this story with us as we tried to tell you the truth and hope that you've been able to take that information and spread it out to others. Remember, whether there's a pandemic or not a pandemic, that the people you hold most dear are the most important folks in your life, which means there's still no place like home. So, at the beginning of the update, we mentioned the name of our studio because the Dolph Simons Jr. family made this technology we use to connect with you possible. The first gift was in 2014. They've added to it twice with the most recent gift, enabling a technology upgrade. I swear to God, it does look like Star Trek, that will allow us to bring even more experts into our conversations with you. We are not going anywhere. We plan to keep doing this update for as long as you have the interest. Thank you for watching. Enjoy this time lapse of what we called the Big Flip. It'll make sense if you keep watching and watch the hard work of our team. They are remarkable.